After almost a year of living with the coronavirus, our attention curve is sloping toward the vaccines. But as officials remind us, it's still important to be tested, whether for individual health or the community. To tell us about testing offered in the North End in Charlestown by North End Waterfront, or NEW, that is New Health, is its chief medical officer, Dr. John Foster. Thank you very much for being with us again, Doctor.
Thanks for asking me.
Doctor, tell me about the timing here and the way people feel because, almost a year ago, we had this surge of infections, a cloud of unknowns. Testing was imperative. And people nowadays, the infections are going down a bit and vaccines are starting to come out. There is worry about the variants of the virus, but when you put all of it together, what does that say about the importance of testing?
Well, I think we have so much more information than we did early on about testing and how to use it, who should get it, that I think it's gotten a lot more organized in terms of how we use testing. Um, I think at the beginning, everyone was sort of rushing around getting tested because we really didn't know who should get tested and who should, who didn't really have to as much. Um, so I think that's been an observation recently. And in fact, the test numbers of people getting tested, the numbers have actually gone down now that the holiday season and going back to college, that whole bump in the cases is sort of behind us a little bit. We're seeing the testing going down. But I think the main things we've learned is that are that testing is important for people with symptoms. I think that would be number one. If you have symptoms that seem like a viral illness, that's an important time to be tested. If you have close contact with someone that turns out to have COVID, meaning not just walking by them, but within 6 feet without masks on for about 15 minutes, that's a good reason to get tested, even if you're feeling fine. Um, and then obviously for travel and gatherings, testing is advised. Most states now have pretty strict restrictions on even interstate travel without testing or needing to quarantine. I think for the average person who's following mitigation, who's not attending risky gatherings, who's wearing their mask, who's feeling fine, I think getting random tests is probably less important. I think the idea that everyone should get tested repeatedly, no matter how they feel, no matter what their environment has been, really, I think is not that necessary. And in fact, whereas in the beginning, the insurance companies were pretty much covering tests on symptomatic or asymptomatic people. Now we've seen asymptomatic people, for example, travel or just I want to know, getting billed for tests, and it can be a reasonable amount, over $100, even $150. So I think being a little more judicious about getting yourself tested is helpful.
I can imagine a lot of people who are not taking unusual trips very far away, but maybe they commute to work every day or they work in an environment where there is some possible exposure and they might have an older relative at home or someone whose immunity is compromised. What about the argument for them to be tested, at least maybe more frequently?
Well, I think you can make an argument if you're, for example, living with someone very high risk. Uh, but again, I think that the main thing you should be doing in that situation, rather than getting a test once a week or something, is just to be really very strict about your own safety, bringing things into the house. So I think, hopefully your work site is safe. If it isn't, and you have someone at risk at home, that's something to think about. But I think the risk is still reasonably low for people who are really being careful and not having a lot of people in and out of the house. I think having children at home obviously opens the door to a lot more potential spread if they're in and out of a school setting or even just playing with friends. I think the household bubble has to be pretty strict to be safe for your elderly person at home, for example. Um, but in those situations, I think that one could make an argument, I'm going to get tested once a week just as an extra precaution. I think that makes sense.
When people hear North End Waterfront in Charlestown, they don't readily associate that with some of the groups that have been identified as being more at risk for the virus or having a disproportionate number of infections. But you do have a site at a public housing development in Charlestown, and I imagine that includes part of the Latinx population. There have been concerns about that even beyond the city of Boston. Anything you could say about reaching out and making contact with that population?
Yeah, well, I think that's very important that, our facility there is essentially across the street from the housing development area, so that accessibility to care is really easy. You just have to walk across the street. So to have testing available so easily right next to where people live without having to get in a car or figure out how to get to the testing site, I think is the big thing. We have, a completely bilingual staff. There's a lot of information going out as best we can into the community to offer them not only medical care, but the availability of testing. And I think that's been very helpful. I think you need to reach out into these communities in a multi-pronged manner.
If you go back to the early days of COVID-19 testing, we've heard these reports about it being invasive. It was time consuming, at least as far as waiting for results. And sometimes they weren't always accurate. What has happened since then?
Yeah, well, I think the two types of tests are still basically the same. They're the tests that amplify the RNA of the virus, which are the PCR tests, which are the ones that people remember with the swab going way back in their nose. And then there are the rapid tests that really look for fragments of the virus. The rapid tests just aren't that accurate, especially in people without symptoms. So whereas it is a test, for example, at Mass General, they don't accept those as indicative of infection or not. You have to get a PCR test. I think one thing that has been a big advance is the nasal swab now can be put in the front part of the nose, called an anterior nasal swab for a PCR. This makes the testing fast. It's not uncomfortable anymore. And pretty much everyone except some certain situations in the hospital can now get an anterior nasal PCR test, which is easier to do. So that's been a big change from the beginning.
I know this is a difficult period for all kinds of healthcare providers, whether primary or acute. But what about some of the secondary benefits of somebody showing up for a test, maybe engaging them in the whole spectrum of care? Is that happening in any way?
Absolutely, yeah. Especially again in our Charlestown site. I think when people come for tests, they actually ask them, we ask people, do you have primary care? And there's a real active effort to sign people up for medical care who come for tests and may not have primary care again, especially in our Charlestown site. So yes, we take the opportunity to offer a lot to people and also offer assistance with other things that we can do, help with housing, food insecurity. Those are all things that are asked when they come for testing.
I know you mentioned how accessible these are geographically if you live in the neighborhood, but we should maybe make sure we spell out who's eligible for the test, at least that you're offering, and how they can take advantage.
Well, I think our testing site is generally serving our community, the North End one. We're not excluding people who want to get a test here. We test plenty of people that don't live in the North End. The Charlestown site likewise is open to scheduling for outside patients outside of that community. But I think there's lots of testing sites around the city, especially the state-run sites at Stop the Spread. So if you go online to the Department of Public Health website, you can find all the testing sites in the state. And importantly, the Stop the Spread sites, the tests are free. If you go to other venues like ours, and in Charlestown, all the Mass General Brigham sites, many of the hospitals, those tests actually won't be free in some situations. For example, if you don't have symptoms. So, yeah.
Finally, if people want to get a test, is there any process they need to go through, at least as far as getting an appointment? And for people who are concerned about eligibility for coverage, normally that would be a big problem, but I think here it's going to be different.
Yeah, I think they should probably call their insurer to find out if there are any situations where coronavirus testing won't be covered. But I think in general, again, if you're getting tested for travel or you want to know because you for various reasons. Those are called discretionary tests as opposed to ones for symptoms, contact, or going in for a procedure in the hospital. The latter three situations, insurers are covering those pretty well. But for tests when you're asymptomatic, those are the ones that you may well get a bill from the testing site. I think going on, again, the DPH site will list all the options for you, especially free testing.
And for New Health, are we talking about walk-in tests or make an appointment? And if it's the latter, how should people do that?
I think they would call our facility to make an appointment for a test. Yeah.
Great.
And we do it by appointment because we really don't want a line of 50 people out there. Yeah.
Great. Well, thank you again very much for joining us and taking the time.
Great. Thank you for asking me.
There is Dr. John Foster from New Health. We'll have more news in just a moment.